In standard anatomical position, which bone is lateral to the other between radius and ulna? Radius, humerus, scapula, or ulna? Radius. In anatomical position, the thumb side radius is on the outside, while the pinky side ulna is on the inside, making the radius always lateral. What is the position of the nose relative to the ears? Medial, lateral, superior, or inferior? Medial. If you draw an imaginary line down the center of your body, the nose sits on that line while the ears are out to the sides, making the nose medial. What two portions does a frontal plane incision create? Anterior and posterior, superior and inferior, left and right, or proximal and distal? Anterior and posterior. Imagine slicing a person vertically from ear to ear. You'd separate the front half from the back half. What is the position of the wrist relative to the elbow when referring to the shoulder? Distal, proximal, medial, or lateral? Distal. Moving down the arm from shoulder to fingers, the wrist is farther away than the elbow. What is the position of the vertebral artery relative to the subclavian artery? Superior, inferior, medial, or lateral? Superior. Vertebral artery is superior to the subclavian artery at its origin. What is the position of skin relative to skeletal muscles? Deep, medial, distal, or superficial? Superficial. Think of your skin as the outer wrapping and muscles as the package inside, making skin superficial. In which position do the radius and ulna remain parallel without crossing? Lithotomy position, anatomical position, prone position, or supine position? Anatomical position. In anatomical position, radius and ulna are parallel. They cross when palms face backward. Where is the patella located on the lower limb? Posterior aspect, medial aspect, lateral aspect, or anterior aspect? Anterior aspect. It is on the front surface of the knee joint. How are ribs positioned relative to the skin? Medial, deep, distal, or superficial? Deep. You have to go through skin, then fat, then muscle to reach the ribs, making ribs deep structures. What portions does the transverse plane create? Medial and lateral, superior and inferior, anterior and posterior, or left and right? Superior and inferior. Transverse plane divides body into upper and lower portions. What is the position of the little finger relative to the thumb? Medial, lateral, proximal, or distal? Medial. When you hold your hand palm up, the little finger is closer to your body's center line. How is the heart positioned relative to the sternum? Superior, posterior, lateral, or anterior? Posterior. Your heart is protected behind your breastbone, like a treasure chest behind a door. Which structure would a mid-sagittal cut through the head pass through? Shoulder, external ear, hip, or nasal septum? Nasal septum. Mid-sagittal plane divides body into equal left and right halves, passing through midline structures like nasal septum. How are the dorsal and ventral roots positioned relative to the spinal cord? Dorsal, ventral, lateral, or medial? Dorsal. Dorsal roots are dorsal to ventral roots at the spinal cord. In anatomical position, how do palms face relative to the femur? Posterior, medial, lateral, or anterior? Anterior. In anatomical position, when you stand with your arms at your sides, your palms face forward toward the front of your body, while your femurs point straight down toward the ground. Therefore, your palms face anteriorly relative to the long axis of your femurs. Which carpal bone articulates directly with the radius? Pisiform, lunate, triquetrum, or scaphoid? Scaphoid. The scaphoid bone in the proximal carpal row articulates directly with the distal radius. What tendon is found laterally in the anatomical snuff box? Flexor carpi radialis, palmaris longus, flexor digitorum superficialis, or abductor pollicis longus? Abductor pollicis longus. The anatomical snuff box has abductor pollicis longus and extensor pollicis brevis tendons laterally. Which rotator cuff muscle is located on the anterior scapula? Supraspinatus, infraspinatus, subscapularis, or teres minor? Subscapularis. It originates from the anterior surface and functions in internal rotation. Which finger do the thenar eminence muscles move? Index finger, middle finger, little finger, or thumb? Thumb. They control thumb movements. Which nerve passes through the carpal tunnel? Radial nerve, musculocutaneous nerve, ulnar nerve, or median nerve? Median nerve. It travels through with flexor tendons. Compression causes carpal tunnel syndrome. Where is the deltoid tuberosity located? Ulna, radius, humerus, or scapula? Humerus. It is found on the lateral midshaft as the insertion point for deltoid muscle. What is the position of the tibia relative to the fibula? Medial, anterior, posterior, or lateral? Medial. It is located medially and bears the majority of body weight. How is the brachial artery positioned relative to the biceps brachii? Lateral, medial, superficial, or deep? Deep. It is located deep to the muscle in the anterior compartment of the arm. What is the relationship between the external oblique and internal oblique muscles? Lateral, superficial, medial, or deep? Superficial. It lies superficial to the internal oblique in the abdominal wall. How is the common carotid artery positioned relative to the internal jugular vein? Lateral, anterior, posterior, or medial? Medial. It is positioned medial to the vein within the carotid sheath. What is the position of the spleen relative to the stomach? Superior, inferior, medial, or lateral? Lateral. It is located lateral to the stomach in the left upper quadrant. How is the popliteal artery positioned relative to the popliteal vein? Anterior, lateral, posterior, or medial? Anterior. It lies anterior to the vein within the popliteal fossa. What is the relationship between the trachea and thyroid gland? Anterior, posterior, medial, or lateral? Posterior. The thyroid gland wraps around the front and sides of the trachea, making the trachea posterior. How are the kidneys positioned relative to the psoas major muscle? Anterior, posterior, medial, or lateral? Posterior. They lie anterior to the muscles in the retroperitoneal space. What is the position of the gallbladder relative to the liver? Inferior, superior, medial, or lateral? Inferior. It is situated on the inferior surface within the gallbladder fossa. How is the pancreas positioned relative to the stomach? Posterior, anterior, superior, or inferior? Posterior. It lies posterior, extending horizontally across the posterior abdominal wall. What is the relationship between the femoral artery and femoral vein? Posterior, medial, lateral, or anterior? Lateral. In the femoral triangle, the artery is lateral to the vein, which is remembered by the mnemonic navel. How are the lungs positioned relative to the heart? Lateral, medial, inferior, or superior? Lateral. They are positioned lateral to the heart within the thoracic cavity. What is the position of the duodenum relative to the stomach? Anterior, inferior, posterior, or superior? Inferior. The duodenum forms a C-loop that curves downward from the stomach's outlet. How is the sciatic nerve positioned relative to the piriformis muscle? Posterior, inferior, superior, or anterior? Inferior. The sciatic nerve passes below the piriformis muscle in most people. When this relationship varies, it can cause piriformis syndrome. What is the relationship between the optic nerve and eyeball? Medial, posterior, anterior, or lateral? Posterior. The optic nerve leads through the posterior pole of the eyeball, connecting the retina to the brain. How are the adrenal glands positioned relative to the kidneys? Inferior, superior, lateral, or medial? Superior. They sit superior to each kidney. What is the position of the urinary bladder relative to the pubic symphysis? Superior, posterior, anterior, or inferior? Posterior. It is positioned posterior in the pelvic cavity. How is the subclavian artery positioned relative to the subclavian vein? Inferior, superior, medial, or lateral? Superior. It is located superior to the vein beneath the clavicle. What is the relationship between the esophagus and trachea? Lateral, medial, anterior, or posterior? Posterior. It lies posterior to the trachea throughout the neck and thorax. What is the position of the brachialis muscle relative to the biceps brachii? Deep, medial, lateral, or superficial? Deep. It lies deep, directly on the humeral shaft. How are the dorsal scapular nerve and rhomboid muscles positioned? Deep, superficial, medial, or lateral? Deep. The dorsal scapular nerve runs deep to the levator scapula muscle and then courses anterior to the rhomboid muscles to innervate them on their anterior surfaces. What is the relationship between the vastus medialis and vastus lateralis? Posterior, medial, lateral, or anterior? Medial. Vastus medialis forms the inner portion of the quadriceps group adjacent to the femur's medial aspect. How is the spleen positioned relative to the left kidney? Superior, lateral, medial, or anterior? Anterior. The spleen is situated in front of the upper pole of the left kidney, separated by perirenal fat. What is the position of the common bile duct relative to the portal vein? Posterior, anterior, lateral, or medial? Anterior. It is positioned anteriorly in the hepatoduodenal ligament. How are the flexor tendons positioned relative to the carpal tunnel? Deep, superficial, medial, or lateral? Deep. The flexor tendons occupy the central space within the tunnel, with the median nerve positioned most superficially among them. What is the relationship between the diaphragm and inferior vena cava? Posterior, inferior, superior, or anterior? Superior. The IVC traverses the caval opening in the diaphragm central tendon before emptying into the right atrium. How is the sigmoid colon positioned relative to the rectum? Inferior, posterior, anterior, or superior? Superior. The sigmoid colon empties into the proximal rectum, marking the transition from the colon to the rectal ampulla. What is the position of the brachioradialis relative to the pronator teres? Lateral, medial, deep, or superficial? Lateral. Brachioradialis lies in the radial compartment of the forearm, while pronator teres occupies the anterior compartment medially.